Hello, and welcome to Nurse Rosa's Insights podcast. Today I'm here with Nurse Gilanie. She is also known as Citizen Nurse. And as nurses, we connected on social media. So I'm so excited to get to have this conversation with you today, Gilanie. Thanks for joining me.
I'm very excited to be here. Thank you for the invitation, Rosa.
You are also a podcaster, and so we've connected about that as well. But can you share your history with our listeners who have not met you yet, as far as what is your stake in healthcare and your background?
Sure, of course. So by background, I'm an oncology nurse. I have been in nursing for, I'm trying not to say this, but my brain just says, it's kind of funny. I've been a nurse for nearly a quarter of a century. Seems like a
I
long
love
time.
that.
But I have many nurse friends that have been nurses much longer, and so many mentors. I actually started in med surg. I went into oncology because I had a family member with cancer at the time, and so that sort of led me into that. I also worked a little bit in NICU. So for those of you that don't know about NICU, it's a neonatal intensive care unit, and I think it's a very well-kept secret among nurses because you're just like cuddling and swaddling and taking care of these precious little babies. And I did that for almost 5 years, and then decided to go back to oncology. And in the oncology field, I've worked anywhere from research, infusion, helped a little bit with care coordination, and now I'm in a formal leadership role, which I've been in for many different types of leadership roles within the last 6 years. So have kind of run the gamut, and my heart is in oncology, though I do have such an appreciation for nurses such as Nurse Rosa, who are very passionate about their specialty as well. And I always like to learn what other nurses are doing out there.
Yeah, and you've really expanded past your specialty into accessible information for all nurses about leadership and also citizenship. Can you tell us
Yes.
about how you became identifying as citizen nurse?
Sure. I was not ever into politics or civics. And I went into nursing to be a nurse, to be in healthcare, not to be in political science or anything like that. But the pandemic really changed my outlook on the nursing profession, and just the way our country supports healthcare. And for those in the healthcare field that recall, the pandemic was a very difficult time because all over the country, I felt like we didn't have the resources that we thought we had to take care of our patients or even, our colleagues. We had very thin or very spread thin nursing resources, healthcare resources at the time, and people didn't know what was going to happen in the next week or two or even months, just because we didn't have any ways to take care of our patients who were very sick with COVID. And just having that feeling of, okay, why are we in this situation as a country or even in the world? Like, why are we in this situation? And as nurses, how come
Did
we
you
didn't have our
feel,
resources?
yeah, did you feel like that's something you trusted the government to have under
Oh,
control
yes,
before?
absolutely.
Is that what changed?
Yeah, even if not the government, maybe like the hospital system I worked in, or the county, or somebody, the medical associate, somebody like
You
would
figured
have us.
some
We figured it.
people up there
Yes,
had
yes,
answers and
yes.
they were prepared.
That's right. That's right. And then, I reference this a lot, and I'm sorry if I spoiled the Wizard of Oz movie for anyone, but there's that if you haven't watched it, why haven't you watched it? It is that moment where Dorothy and the crew, they pull back the curtain thinking they would find this magnificent wizard, and it was just like this regular guy that was kind of like, making things up as he went along, and just, something that who they didn't imagine. And so that was my Wizard of Oz moment where I realized, wow, these resources, these entities I thought would have our backs because, our job is to take care of patients, to take care of healthcare systems. And, why shouldn't we have infrastructure to support us when things go wrong? So that Wizard of Oz moment really gave me some mixed feelings of, anger, because I'm like, well, how come there isn't anyone there? But also at the nursing profession, because I mean, we're one of the most educated professions. We're one of the, we're biggest in number. We have millions of nurses in this country. And yet, how did we allow this to happen to ourselves? And, I make these kind of general, comments, but I think it's true. And I talked to nurses at the time all over the country, and this is where my advocacy journey started.
Mm.
Of policies that kept changing like almost every hour it seemed like. And I was a supervisor at the time in my um, uh, healthcare institution, and it was a very difficult situation, making sure that your staff felt that they were supported and safe and things were going to be okay. But you, on the leadership side of things, not knowing really what was going to happen in the next couple of days. And I know this was the same story through many healthcare systems throughout
Yeah.
America at the time. And one of the most, I guess one of the stories that I heard from a nurse up in San Francisco, because I was trying to grow my advocacy network of friends at the time, really stuck with me, where she worked at a low-cost clinic in one of the more lower social economic areas of San Francisco. And she would have to barter with someone, I don't recall who, just for gloves. Like, she would meet them like somewhere,
Yeah.
like, in the alley, almost, like, say, okay, how many gloves can you give me? How many masks can you give me? And I'll see what I can give you from our clinic, or, I'll pay for them. So, knowing that we went from what I believed was a very advanced and sophisticated healthcare system in this country, and hearing these stories, I was like, oh no, this has to change. And I don't know exactly when it happened, but I know it was like in the fall of 2020, maybe early 2021, where I thought, if I could do something so that if there is a pandemic or something of the scale that happens in the future, the nursing profession will not have to go through what we went through again. And in my search for answers, it really led me to legislation, health policy, government, really, because what in our institutions aren't touched by the government? Something as simple as HIPAA, right? So patient privacy, that comes down from the government.
Wait a minute.
Medicare.
HIPAA is simple? What?
That's true. That is very true. That's simple. That's simple. But I mean, even like our timekeeping policies, right? Like our payroll
Yeah.
records, it's regulated by the government. So many things are
Yeah.
regulated by the government. But who's making these policies? Um, who's doing these regulations? Are they people in healthcare? Like, you have to peel back the layers of the onion and see what is at the core. And I really thought, nurses need to be at those tables where decisions are being made, need to be at the core of healthcare policies that are being made, and also part of the regulation process, because we know
Yeah.
what we do as nurses. We know what happens on the front lines. We're the subject matter experts, versus it being trusted to a bureaucracy. And so that's how my journey began. And I have so many mentors, so many people that I need to just thank in my growth, in my journey. And interestingly, I always felt like, I never pictured myself in this situation, having, going into politics, or, understanding how the processes work. But when I always thought, okay, well, I think I've learned enough, and maybe it was just like a passing kind of feeling, and things are getting better now. But opportunities would come up, or I would meet other people that would inspire me to keep going forward in this journey. And I think what has been the most heartwarming is when other nurses have come up to me or asked me, like, how can they do more, or what can they do? And I've always envisioned myself as, if you had like a big circus tent, what is that person that tries to get people into the circus tent? But I'm
Oh,
to see the show. I forgot what that term is, but that's how I picture myself.
I don't know. In
It
church, they call that an usher, I think. So I don't
could
know what they
be.
call it in circus. Is it an
It's
usher? I don't know.
Because people always think, "Oh, Joanna, you're gonna run for office or you're gonna be a politician." I
Mm-hmm.
said, "No, that's not how I envision myself. I envision
Mm-hmm.
myself as um, showing the people the path of
Mm-hmm.
advocacy, and what you do on that path is really up to you. But we need to get involved. I really feel as it's um, the not the final frontier. There's always going to be a new frontier, but at the time, like in the early 2020s, 2021, 2022, it was um, a new frontier. There were at least only a few nurses that have done a lot in advocacy or been involved in government at the time. Um, but we can, with millions of us all over the country, why don't we have more of us in these decision making
Yeah.
positions? So I imagine myself as a person ushering in other
Mm-hmm.
nurses that are inspired to go on this journey. And there's really no way you can go wrong, actually, I feel like, because if it's someone telling me, "Oh, Giovanni, you're doing it wrong. This is how it should be done," or "Why are you saying these things?" I feel like I've already succeeded because I'm already engaged. I've already engaged someone in the conversation.
Oh yeah.
Um,
Well, let's talk about how that you're
yeah.
doing that. How are you engaging people in this conversation?
Yes, so I have some social media platforms now, and I've liked Instagram and Facebook as well, just for my own personal use, and
Mm-hmm.
I used it quite a lot. But then in my messaging and journey, I thought, how could I be a more public persona to get the information out there? So
Mm-hmm.
somewhere along the line, um, I was also studying for my master's degree. Um, and that's how I lost my mind, by the way. The pandemic, I was in a leadership
You
position
lost your mind.
and I was in a master's degree program. I don't know. I don't know what it
Wow.
was. And at some point, my brain was like, no, I'm tapping out. This is not like, why are you doing this to me? But, but in the master's program, we we had like an advocacy course and what nurses can do in health policy.
Okay.
And I realized at the time in my undergrad program, which was many moons ago, I never even like encountered health policy, or maybe I was absent that day or paying attention, but I just know it wasn't
Right.
part of the curriculum because I don't remember doing anything um, like that. And it was a formal 4-year BSN program, very prestigious. And I don't remember doing that. So I was like, okay, well, where's the gap and what changed over the years? And then I realized most nurses in conversation and talking to people didn't encounter advocacy, health policy, or these types of topics until their graduate level program.
Oh.
And going on social media, seeing the nurses that were on there on TikTok and all that. And there were many nursing accounts that make light of the nursing profession and have jokes, which I enjoy. I think they're just hilarious. There's some great creators out there.
Mm-hmm.
But what could I do to reach that audience, the younger
Yeah.
nurses coming in, the nurses who have just graduated or have not encountered health policy advocacy in their programs, or even I think a big thing was nurses didn't know that they could do this. Like, that's
Yeah.
how I was when I first started on
Mm-hmm.
this advocacy thing. I'm like, can nurses do that? Like, are we allowed to? Are we allowed to do
Right.
that? Are we
Exactly.
allowed
Who
to
do we
talk
need
about
to ask
it?
permission
Yeah, yeah,
from for
yeah.
this?
And so knowing that most graduate level nurses, PhD prepared, master's prepared, I mean, they got it. They understood the importance of nurses being involved, well, for the most part, right, in these uh, government decisions. I thought, well, they already get it, but how am I going to reach the nurses that don't even know that this is an option for them, or don't even know
Mm-hmm.
like how this will benefit them as a profession? And
Mm-hmm.
most of those nurses live in social media right now, right? Whether it be
Yes, they
TikTok,
do.
Instagram. I'm sure that there's something right now, another platform that's just coming up that we don't even know about yet. But
Well, and it's
so
funny
I
you
have.
should mention that because, like, when I was at the World Stroke Congress in
Mhm,
Toronto last year,
mhm,
there was a very compelling presentation talking about
mhm,
where do people get their healthcare information. And the majority of people surveyed stated that they got their healthcare information from Facebook, Instagram, and TikTok, and not from, validated sources. And so that's where people are.
yeah,
That's where they're
that's where
looking for
people
their
are.
healthcare information, whether they're a
Mhm,
nurse or a prospective nurse or what. And so I think you're really hitting the nail on the head with let's go where the people are so we can reach
yes.
them with the messaging.
Yes, and that's a foundational nursing concept is meeting the
Hmm.
patient where they're at,
Yeah.
right? So in this case, the patient population, as it were, the population I wanted to reach are a younger demographic. And admittedly, the style and the humor of some of these things different from what I was used to. But watching many social, and I love social media, so like I would just be inspired by creators in healthcare and outside of healthcare
Oh,
as
yeah.
well. And my niece, who I talked about, she's 10, but she's
Hmm.
7, 8 year old at the time, watched all these like YouTube things, and I'm sure you're familiar with your kids as well, where
Hmm.
they didn't
Yeah.
make sense to me. They're like, what
Hmm.
is this? Like it's so odd, it's so weird. But my niece was like rolling on the floor laughing. Like I didn't find it funny. But she was like,
Yeah.
watch this, it's so funny. So I tried to I guess model some of the messaging and the concepts of some of the posts I have based on that. And
Hmm.
now my niece is too cool for me. She doesn't do it as much, but she was
Uh,
like my social media um go to at the time. So I would run everything
hmm.
by her. See
Oh,
if
you'd be like,
if
is
she
this
liked it. Yeah,
boring?
yeah, yeah.
Please
It's
tell
just,
me.
yeah.
How
Would you
boring
want
is
this?
this? Yeah.
Yeah. So that's why I really went into going into social media and with micro learnings on
Hmm.
civics. Initially I called it Civics 101 for nurses, but
Hmm.
I thought, this is it should reach more people, and that might, if you're physical therapist or something,
Hmm.
then I didn't want to exclude anyone, so I have Civics 101 for healthcare. And what it is
Hmm.
really is just basic civics concepts, like how a bill becomes a law, how the
Hmm.
government is set up, um all the things we probably learned in fifth grade, fourth grade, around that
Or
time. And,
should.
yes,
Or lately, the emphasis on voting, like how to
I'm
register to
voting.
vote, how to make it
Yes,
easier.
yes. And just having the correlation how knowing these foundational concepts really ties into how you practice as a nurse, whether at the bedside or in academia or in, any other industry where you're functioning as a nurse. Um, Micro concepts, like I try to make it less than a minute in the beginning. As nurses do, we want to make sure that we're driving the point home, and try
Yeah.
to explain it in every way we can. But I understood sometimes the shorter the better, because when I, as someone casually scrolling through Instagram and not really interested in this topic, would I sit there a minute and really watch it? So I tried to shorten it, and I tried to refine it over time, and then I expanded into TikTok and also LinkedIn. But
Hmm.
depending on the social media platform you're on, the style, the message, the delivery is going to be
Hmm.
different. I um I was also involved in many nursing associations at the time, and still am. So through the American Nurses Association California, which is um, the state level not chapter, but state level organization of the American Nurses
Right. I always
Association.
want to say chapter two with
Yeah.
the Kentucky Nurses Association. I'm like, what do you say? Like, because chapter is what you call like your city or regional
Yes,
version. Do we call it a branch or state branch of the organization?
it
I don't
could
know.
be.
Somebody
We
from one
should
of these
probably call.
organizations, please leave me a
Yeah,
comment and
please.
let me know.
Yeah. Let us know. So we're referring to you correctly.
Yeah.
But they had well, I joined they had an advocacy institute, and again, it
Yeah.
was just me trying to make meaning and find connection in the pandemic of, what more can I do, and doing tons and tons of research. And
And
when I
was
say
this a
research,
new
like
training
Google.
program for them? Were
I
you in
believe,
like
yes, actually it
the
was new.
first?
I was the second
Okay.
cohort of our advocacy institute. And what it was, and the people at American Nurses Association California, they're phenomenal. What it was is just a year-long training, and we did have to apply and write essays and all this stuff. And there
Hmm.
were a handful of us chosen, and during the year we would have speakers, but also we had topics that we were assigned to, that we would tackle for the year, and see, how policy and nursing intersect, and how we could improve these um, uh, issues in healthcare. So I had a partner, Rebecca Rebecca Zita. She's gotten married and she's wonderful as well. She's a nurse from up near the Sacramento area. So we partnered together and worked on the mental health campaign, and that built on the years before nurse who was in it. And so there, I think there's a new cohort now actually just building on that campaign. So I really got to get like the bones of what advocacy is and how nurses can make a difference through that institute. And I was also very active in at AONL at the time, so the American Organization of Nursing Leadership, and I became part of their social media ambassador program. And the reason for the social media ambassador program was there were not enough nursing leaders that were adept or interested or saw the value of social media. But there were, these few nurses that regularly use social media to engage their teams or to like recruit or retain nurses. And so I got tapped to be part of that. And because I had some social media presence already, so I thought, oh, that's cool. That's the power of social media, right, Rosa? People see what you're doing and your message, and they want to learn more. So the thought at the time was, how can nursing leaders we'll change the narrative, or at least reframe the narrative at the time that nursing was burning people out, or all these horrible things were happening in nursing or hospitals, because there were a lot of TikToks or Instagram where there were negative views on the nursing profession or their hospitals by nurses. But yet, the experience runs the gamut. There's always going to be people that aren't happy where they are in the profession, and then there's people that love it. But the people that love it, or the people that want to really elevate the nursing profession, aren't out there being a voice. So the social
you have to be
media group,
intentional about
you have
that.
to be
It's so
intentional.
easy to make a video that's complaining about something, and it may be completely valid, raising awareness about a valid issue that needs to be addressed. And kind of what we're doing in this whole podcast is taking those issues we're aware of and talking about how to find solutions to them. Right. And I think one very important solution is to also create social media content emphasizing the positive things about being a nurse so that we can reinforce one another in that what we're doing is meaningful. And as nurses, we're doing it because it's a calling, and yes, we should be paid fairly for it, but also as nurses, we're gonna do more than anyone could ever afford to pay us. You're welcome. And let's emphasize what those things are that we're doing that's elevating the health of our community and improving people's lives on an individual level and a community level, like what you're doing.
Yes, it's this is very true. And I know there's this might be a little bit of a as one of my friends calls it, a spicy take. But there's some things happening right now with nurse reimbursement and making sure that nurses are compensated fairly, which I fully support. Nurses should be compensated in a fair way for what they do. We do a lot. But yet the things that we do when we're holding that patient's hand, when we're getting the family through a difficult time, those things are priceless.
They are.
So how can you place value on something like that? And I get a little emotional, but if you say, again, this is I'm kind of making it less complicated than I know it is, but holding a hand for 10 minutes, do I charge for, things like that?
Right.
But what we do is priceless: the compassion, the heart, the experience we bring. I mean, that's why nursing is one of the most trusted professions, because of what we bring and how we touch lives. And I don't know more about the nurse oh my gosh, I just lost the word. What is that called? The nurse like reimbursement and all of that program that's happening right now. I don't know enough about it to speak on it, but just I can imagine it is a difficult road, knowing that, there's so many levels of nursing, so many areas in this country where it's just, we can't standardize, just because that's the reason we're not standardized, is because we're trying to fit closer to, we're trying to mold to the needs of our community, right?
Yeah.
And that's what it's about. So I know, I really admire, people for bringing up this topic and
Oh,
talking
yeah,
about nursing
definitely.
reimbursement, but also recognizing that what nurses offer, what we do, and what, like you said, it's a calling. Those things are valuable, and
And it's so
I
hard
think
to quantify.
you can't quantify it. Yeah.
Yeah.
And it's there are those moments where the reward itself is how you've made a difference in that person's life or that family's life, even if it was in that 8-hour, 12-hour shift, or
Yeah.
however long it was.
But like when
Yeah.
you go to sleep at night, you're going to be able to sleep well knowing that you made a difference in that person's life.
Yes.
And that's why we do it,
Mhm.
Although some people do get awards for their good work. So I think you got an award this year. Can you tell us about that? What you got an
Yes.
award for and more about that?
Of course. Yes, I thank you for asking. So this year I received the American Nurses Association Award for Advocacy in Nursing. And I didn't even know there was such an award.
Yeah, me neither.
My organization, actually, they nominated me for it, and
Yay!
yeah, and I was, it was very nice. It was very nice feeling to be nominated, but also the thought of, like, wow, like I never imagined that I would be deserving, or viewed as deserving
Oh,
for recognition like this.
as soon as I saw it, I was like, she deserved that. I know Jelani earned that.
and so, in terms of elevating the profession, I mean, there's the nurse
Mhm,
reimbursement, there's the financial aspect of it, but also the
mhm,
recognition of nurses. I'm very
mhm,
much a proponent of recognizing nurses, elevating the profession that way, because we're a very seen profession, but we're also unseen. So
mhm,
very seen but unseen. And part of that is because inherently nurses don't want to take the credit, right? We're behind the scenes, we're taking care of the patient, the focus is on them. We have other colleagues that we want to make sure that they're given their due recognition, because we're a team, right?
mhm.
And in all of
Yeah.
this, nothing happens just with one person. But yet, that's the reason why I feel nurses don't have more of a voice out there and more
Mm,
influence, because we are not out there telling people, hey, this is what we
right.
do, and this
Mhm,
is how I can help you. And it's almost something that we try not to do as a profession, but we have to.
mhm.
And I didn't preface all the social media stuff with the fact that I'm very introverted. I know it's hard to tell right now. I'm very introverted. It took me a while to put like that camera. You know, everyone takes selfies, but those were things I shared for
Not
myself, or
everyone
I
takes
didn't post them.
selfies. I found this out. Not everybody takes
Oh,
selfies.
really? Really?
Yeah.
Hmm.
Oh, I don't understand that. You're an introvert, and you even assume everybody takes selfies, but yeah, some people don't. But it's
Everyone takes
different when you're
selfies.
talking to a camera
It's
too, than
different.
versus
It's
taking a
different.
still.
It's different. And then all the things you have to consider is, once it's out there in the internet and on the World Wide Web, all that stuff, you can't take it back very easily. So you have to
Mhm,
be very purposeful in how you're presenting yourself, knowing that you're not just you yourself as Nurse Gilanie and Nurse Rosa. I mean, you're representing your organization, you're representing any of the professional organizations you belong to, and ultimately the nursing profession. So,
mhm.
like you said, being very mindful in how you're putting yourself out there.
Yeah.
Yeah, so there's a lot to consider, and and also be authentic, because you want to be authentic. You don't want to be like, very polished or too robotic, or where you're not being engaging with the audience that you're trying to meet. So that's how something that leads me is, be engaging, be yourself, but at all
Mhm.
times also just be professional. That we have that
Yeah.
obligation to our profession, and the responsibility to do that.
I think then the challenge is being authentically professional.
Yes.
What about
Yes.
that? I thought. Because I know we've been having these classes where I work about the different generations working together and
Mm-hmm.
how you've got, boomers who are about to retire, maybe, and then the Gen Xers, and they
Yes.
have more of that whole professional persona that they were trained for, and then millennials, and then especially Gen Z, like, they will not be tolerating the fakeness.
Yeah.
Like,
Yes.
if
Yes.
it's coming across as scripted, then it's really hard to believe. And so,
Mm-hmm.
that's one reason that I'm just not even like trying to read off of a teleprompter or anything because, I want people to know that I mean what I'm saying here.
Yeah. And the Nurse Rosa they're seeing, on that screen on their phone is the same Nurse Rosa they're gonna get when, you're walking down the street and say, hey Rosa, how are you doing today? And you're gonna come across
Yeah,
us that way. Um,
like,
and I think too that has a lot to do with how we're trained as nurses because
mm,
when you're going into the patient room, when you're doing your assessments, meeting the family, you're you yourself, but knowing that you have to be professional and that the family's
mhm,
watching you, the patient's watching you, your colleagues you're gonna be giving report to them, right? So
mhm,
you have to, you know, make sure everything looks good and is good. And something that always stays with me when I started, in my leadership role early on, is that people are always going to watch you no matter what, just because you're the boss, right? um
mhm,
People are going to always watch you, so you have to be very mindful in how you're presenting yourself. And again, you don't want to be fake and just be nice to people when they're watching, but just just all around, you have to follow and listen to your heart, because if you're in leadership and you're there to lead your team, support your staff, be there for the patients, that shines through, because we've all had bad bosses, and we've all, and that's just the nature of being human, I think, right? People are always going to talk about their bosses or whether they're good, they're bad. So also being in a leadership role, um, is a lot to, you have to think about how you're always going to present yourself. And, we're human and we're not going to be at the best, um, at all times, but just having authentic and meaningful conversations with your staff, and, having them know that you're there for them. So that was one of the best lessons I learned early on.
that's awesome. Well, Jelani, I need to ask you $1 billion question. Are you ready for that?
Yes, yes. Very excited for it because I
So,
have a great answer.
yay! I'm so glad, and I have no idea what it's going to be. So it's going to be as much a surprise to me as anyone else. So, this comes from the American Nurses Association that trained you in advocacy, by the way. But their foundation did research indicating that 1% or 1 penny of every dollar that's donated to healthcare in philanthropy is directed towards nurses. And that's where I heard them say, that's $1 billion. And we would love to double that and have $1 more billion given towards nursing. But if it's going to be given towards nursing, it needs to be, or whatever you want to do in healthcare, it needs to be used strategically because that will run out. And so, what I want to ask Jelani is, from your perspective and your experience, what needs you see that you would like to see met if you were given a grant of $1 billion, and how would you like to see that used so it's as strategically effective as possible?
Wonderful question. And it is true, you think $1 billion is a lot, but it runs out quickly. One of my dreams, and this ties into my mission of advocacy and getting more nurses at those tables where these important decisions are made, is to form a nurse-run, nurse-led think tank where
Mm,
we could do our own research as nurses, but also do education, fund education based in health policy for nurses. Because I've done research and I haven't found much out there.
mm,
So really to create a think tank where nurses could kind of have a blank check almost in um, conducting a research in the realm of healthcare and political science, healthcare and advocacy, nursing and health policy, anything in that realm. But also do programs to educate nurses and write policies, partner with politicians to identify where the pain points are in our healthcare system from the nurse perspective. As we are one of the most trusted professions, and with 4.5 million of us in this country, we really need to be one of the most influential professions, which I think we're very far from right now. So how can we get there is through funding, which, that's something I've been thinking about for many years now. Like, how do I do something like this? But also through support from outside entities where they want healthcare in this country to be better. Because I think if it's a certain healthcare, or if it's within the healthcare sector funding it, I think there's a blind spot because, we're going to kind of go with muscle memory and this is what we've always done and let's do it this way. It's like, kind of going around in a circle. But the point of view from the outside is going to be very different. And that's where the influence of nursing can really grow, is by partnering with entities outside of healthcare to tell them, hey, this is what's happening. This is, what we need. This is what we're headed for if we don't do A, B, or C. So that's what I would use that. If there was a grant, I would use it to create a think tank. And also, because I'm an oncology nurse, the focus of it would be oncology legislation. But why limit it to that, right? That's kind of
Let's not limit it.
Yeah. It's
Let's
not
go for the moon.
Yeah, let's go for the moon. And as you know, you've been part of conferences and writing abstracts at the time. Sometimes research studies are funded by institutions or not funded, but it's like, as a nurse, you have to partner with the institution. This think tank of mine, my idea of a think tank would really just be kind of like the Google for nursing, like a Google, the headquarters. Like, you come in, what ideas do you have to make healthcare better? And these are all the tools and resources you need, and go for it. So that's my dream. And I am, I'm gonna keep pursuing that until I can make some headway in it. So
well, you're
a grant
already laying the groundwork by just raising awareness about citizenship and empowering nurses that they can be advocates. I want to put in a plug here because the Kentucky Nurses Association, you would be very proud of, wrote and got passed House Bill 159, which protects nurses and physicians from being criminally prosecuted due to unintentional medical errors. And that was very necessary because some had gone to jail due to mistakes. And that kind of potential for criminal prosecution and being stripped of your license when you did not intend harm was driving people out of the profession. So making it safer to practice and making people willing to work in healthcare, that was led by nurses. That was led by nurses who are civically engaged.
Yes.
And so that is the level of power that can be wielded by nurses to advance bipartisan, let's help every human agendas.
Yes, that's right. That's right.
It had bipartisan support and passed unanimously in the Kentucky legislature. Okay. And nurses can do that. Nurses can be unifying because when we go to treat somebody, we're treating that person no matter where they came from, no matter what they did. We're going to treat them because that's who we are, not because of who they are.
That's right.
Yeah.
And great work on the Kentucky Nurses Association. And
definitely.
And again, this might be a little spicy take for some people, but some people will say politics have no business in nursing. But in this case, it's like, if nursing didn't get involved, the government, politics would be dictating what we do with our colleagues, with our what we do, and that would
politics is already involved.
It's already
we just need to participate.
Whether or not you like, and I love that you bring that up because I neglected to bring it up earlier. It's bipartisan. Like, nurses going into politics, government advocacy, in order to upholds the most trusted, and that image we have to be bipartisan.
Yeah.
We can't take sides. We're there for the patient, and who's going to argue against quality healthcare? That's really our main ask. We want quality healthcare for our patients, no matter what they're going through, no matter who they are. And so if you're framing it in that way, who in the Senate, assemblies, and all that, who's going to say, well, no, I don't want quality healthcare? So it's
Right.
it's the ask, right, and how you're framing it and presenting it. So yes, thank
Exactly.
you so much,
And that's
Rosa.
something I love about you, is that you keep it focused on the goal. So if people want to follow you, they need to follow you at Citizen Nurse, correct?
Yes. Yes, Citizen Nurse, one word.
Yeah, TikTok, Instagram. Where else can they find you with that handle?
YouTube also.
YouTube, yes, because you have a
Citizen Nurse.
podcast.
I do. A very humble podcast just with a few of my friends, and it's fun. And just again too, just trying to get on as many social media platforms as possible, and of course LinkedIn. LinkedIn also has a place where I put more of my personal, professional, I guess persona on there versus the advocacy, but trying to
Yeah,
get the message
it's
into
more
as
about
well.
oncology. Is that right?
Yes.
Yeah.
Yes. But also too,
And
just getting our names and our word out there. That's the goal. Yeah.
that's right. And show that nurses are leaders. We got something to
Yes.
say. And we're here
That's
to participate.
That's right.
Well, thank you for participating with me today, Gilanie. And I gotta put a plug out there. You are going to be one of our featured speakers at the Power Up Nursing Symposium in Louisville, Kentucky.
Yes, very excited. Thank you, Rosa, for the invite. Thank you to
Yeah.
Power Up for the invite. I'm going to be talking about advocacy and how you can make a difference from where you're at. So very excited.
Yeah, our theme is voice and vitality, and you're going to be talking about how nurses can use their voice, and that can increase the vitality of the nation.
Yes.
So, if you have not already registered to come hear Gilanie de Castro in person, and you can see me too. I'll be there too.
Yes, and if you're
All
there,
right.
come look for me. Always happy to connect with anybody. So, thank
That'd be
you, Rosa.
fantastic. All right. Well, thanks for listening to Nurse Rosa's Insights. Feel free to reach out to me on social media or wherever you're listening to this podcast, and follow so that you will be notified next time there's an episode with another exciting healthcare stakeholder. I will see you there.